Thank you for joining today's webinar, What to Do During Downtime with Dr. Mark Wright. This webinar is brought to you by Premier Academy 360. Attend webinars like this one or visit our content library and on-demand learning at learnacademy360.com. Please note we will be sending out a post-webinar email to all attendees with the recording on it in the next 24 hours. Past recordings and handouts can be found at learnacademy360.com. Q&A will be provided at the end of this presentation. Please chat in your questions anytime during this webinar. We want to hear from you and continue to provide content you want. Please stick around after this webinar and answer our survey poll. And now it's my pleasure to introduce our speaker, Dr. Wright. Dr. Wright has extensive experience in consulting, teaching, and lecturing. He is the CEO of the Practice Management Center and is the professional editor of Review of Optometric Business. Over to you, Dr. Wright.
Thank you very, very much. I think for practices that are utilizing staff during this pandemic for projects within the practice, this seminar will be very, very helpful. What we're going to do is look at what 3 optometrists are doing, and then we'll look at 9 more suggestions after that. So let's start with our first practice here. Our first practice is the practice of Dr. Stewart. Dr. Stewart closed her office on March 20th. She has staff working in pairs on a shortened schedule, answering the phones, ordering contact lenses, and triaging care. At the bottom of the screen, you see the web address of the entire article that Dr. Stewart wrote and placed in Review of Optometric Business. And so you want to read if you want to read the whole article, then go to that location and you can read her whole article. She did some more things. She has her door to the office locked at all times. That means no patients are entering the office. She has 1 doctor on call each day for emergency care, and she's introduced telemedicine into her practice. Now, while she's been down, she's negotiating delayed vendor payments. She's thinking of strategic ways of reducing expenses. And that's extremely important because one of the concepts that you really want to think about from the strategy inside your practice is to make sure that the practice cash flow remains positive. You do not want your practice cash flow to go negative. So this thinking through how to reduce expenses is key during this pandemic. She's also inventorying optical products. She's catching up on insurance claims. She's utilizing online learning, and there are lots of sources for online learning in today's world. Most of your vendors have some sort of online learning program. Some of them are very comprehensive. Some of them are enabling your staff to get further confidence in their work, and some of them actually are helping them to get certification. So as you look through all the products that are out there, make sure that you're choosing the ones that are best for your staff. And she's building a social media calendar. I love marketing. I think marketing is essential for a practice. And one of the things that you must think through and actually plan well is having a social media calendar. There are many sources. Just Googling social media calendar will bring up many sources for you to explore to help you do this as well. Dr. Whipple is our next doctor to look at. Dr. Whipple is only open to emergency patients. He's having his staff meet regularly via Zoom conferences. His staff members are working on vision source learning trainings. Again, this is just another example of one of the vendors out there that has online training for staff. Dr. Whipple sent out 2 email blasts to every patient, and the main message of these 2 email blasts were, number 1, we are following the CDC recommendations inside the practice to keep our patients, our staff, and our doctors healthy. and we are postponing routine care until May 1st. Now that date may change as we move closer to it, and he may send another email blast out, but he's keeping his patients informed of what his thinking is. He's also calling all patients who have expired contact lens prescriptions, or even those whose prescriptions may be expiring soon, keeping that flow of income inside the practice. Very positive, very helpful. Now, thinking of contact lens patients, this is an actual letter from an optometrist to a patient. And so I blocked out the patient's name and I blocked out the optometrist's name. But I thought this was a nice example of what you could send to your patients. Hello, whatever the patient's name is, we hope you are doing well. You and your loved ones' health and safety are a priority during the health pandemic. While our physical offices are closed, compliant with state law, we will continue to support our patients remotely. Should you find that your contact lens supply is running low, we are extending a way for you to reorder without coming into the office. We can fulfill your order via email, phone, or text. We will respond to all requests, but please be patient with any slight delays. Shipping is complimentary to any address in the U.S. Please include the address you would like shipped to in your communication. We can follow up with an overall eye health exam at a later time. And should your prescription change at future appointment, we can swap out any unopened boxes for your new prescription. So there's no risk in ordering a supply now. Most importantly, be well. Best regards, the doctor's name. Now, as you read that letter, the one thing that came across to me in just clear tones was this doctor cares about his patients and their loved ones' health and safety. That is the priority. Starts the letter with that and ends the letter with that. That really context, those bookends, put this letter in context for the patient. Yes, here's some mechanics that we might need to think about in terms of keeping your contact lens prescription current and your eyes healthy as we go through this, but I'm really, really caring for you. Great letter, I thought. Let's move to Dr. Rettig. Dr. Rettig has 80% of the staff laid off. He says last year he changed how he budgets and managed the finances, and that put us in a better position to weather this crisis. As a general rule, any practice should have 1 to 2 months of the annual practice revenue in an easy, accessible fund so that if any issue comes up, well, guess what? 1 to 2 months of money during this pandemic would have made a huge difference in a lot of practices. And practices that are running on too thin a margin and don't have that extra cushion set aside for emergencies have run into problems during this pandemic. I thought this statement that he made was really helpful. The best thing ODs can do to help with the COVID-19 relief efforts is to see that emergency patients and to let local primary care physicians and urgent care centers and walk-in clinics know that you're available to see their ocular emergencies. If we can keep the emergency rooms and other clinics free from eye emergencies, that will keep those healthcare professionals available to treat patients affected by the COVID-19. Again, at the bottom of the screen, you have the address if you'd like to go read this article and in review of Optometric Business. Dr. Rettig says, we're still seeing emergencies, and we're still doing telephone or website contact lens ordering, and we do curbside pickup for glasses. He also states that all the doctors in the practice are independently working on ways we can improve our care when we reopen. For example, one of my partners is evaluating our current dry eye and AMD protocols. I'm hearing practices across the country doing this, thinking of ways to reimagine the practice, ways to rethink how it is that we deliver care within our practice, so that when we open back up, we have better systems in place to make the practice working. We've opened up our options to provide telehealth services to our patients, and Dr. Rettig is using doxy.me, which is, when I talk to all the millennials out there, all the millennials are telling me that this is their favorite telehealth system to use. Now, if you want to talk about telehealth, you need to go read anything written by Dr. Rothschild. Dr. Rothschild has a beautiful article in Review of Optometry Business, and in it he identifies these 7 steps: set your protocols, write your script, pick a meeting platform, communicate with the patient, map out the visit, establish a process for your virtual at-home office visit, and remember rules for clinical judgment. That last one is incredibly important. Doctor, you are always in charge of the patient, and make sure that you accept that responsibility and fulfill that responsibility. Now, here are 9 more actions for you to take during your downtime. And these 9 actions I think are really important. Number 1, reimagine your office. Create the dream practice that you always wanted your office to be. This is the time to think through that. This is the time to put in place what that would look like. Your practice may have devolved into just the practice that you tolerate over the years because that's the way it's happened. Take advantage of this time where we have some downtime to rethink through what your practice needs to be. One example I can give you, which is very powerful, is we've known forever that the longer it takes the patient to get into the optical, the less they will spend in the optical, and so therefore we want to get the patient into the optical faster. So I found a practice in Texas, and this practice in Texas gets patients into the optical within 15 minutes of crossing the threshold, and they have over 100% capture rate. Well, how do you get over a 100% capture rate? That includes walk-ins as well. So that capture rate approaching 100% is dramatically better than the average practice in the country, which hovers around a mid-60% capture rate. It is a far better use of your time, efforts, and energy to increase your capture rate than it is to go out and try to capture new patients. So by reimagining your practice, dividing the practice exam for your patients into a refractive exam and an eye health exam. And you're going to do both parts of the exam today, but when that patient crosses the threshold, you're going to focus on the refractive part of the exam first, get them into the optical, then when they're done with that, you take them back and do the medical part of the examination. This is a very new way to reimagine your office. There are other ways you could think of as well, so this is the time to do that. You also must create the patient flow for the new normal. When we come out of this pandemic, you're not going to have the same kind of patient care as you had before this pandemic. There's a practice I'm aware of that took out a wall to create more space in the optical for social distancing. Practices have changed their reception area, cutting them in half, having patients wait in the parking lot until they're called into the practice so they can immediately go into testing. So again, thinking through how's the best way to handle social distancing, keeping our patients, our staff, and our doctors healthy as they move through the process. We also have to think about personal protective equipment for both staff and doctors. What is that going to look like? Are your doctors going to wear just the N95 mask, or are they going to wear the N95 masks with a face shield? And what about your opticians? What about the rest of your staff? How are they going to handle things? One of the things you want to think about is the credit card machine. You want to create new credit card machines in your practice where the patient doesn't have to hand your staff a credit card, but they can handle the credit card transaction through a tap or at worst a slide as they complete the transaction. It's time for new systems in your practice. You have known for a long time that there are some systems in your practice that may be broken or inefficient or maybe even non-existent. This is the time to rethink through those systems to make sure that your systems, when you open your practice back up, are operational and efficient. Staff training. Staff training is huge, and this is the time for you to think about staff training. And I always think about the first thing is writing up the position that every staff member has. And it shouldn't be the doctor writing up these positions, it should be the staff member. Here's a little piece of data that you need to know. When you lose a staff member, when they're fired, when they move on, when they get married and leave your practice, when they choose a job, some other practice, I promise you there's information in their head that no one else knows about your practice, whether it's a system, whether it's about a patient. There's information that will take you 3 years to recover. So one way to get around that is to have every staff member write up their job, write completely up their job. What are the end products that I need to produce in my job? What are the systems that I need to have in play in my job? What is the education or skill sets that I need to have in order to do my job? What is the reporting process? All of that information needs to be written up for every position within the office. And I made the statement that every staff member needs to understand what they produce. That is a big failing in most practices that I have seen. If I ask a staff member, what do you produce for this practice? Most staff will tell me what they do, but they won't tell me what they produce because they don't know. The easiest example I can give you is the recall person. The recall person does a lot of things. They send out emails, they send out text messages, they may even make phone calls, or they deal with a computerized system that makes the phone calls for them. But that's not what they produce, that's what they do. What they produce for the practice is an established patient in the practice presenting for an eye exam. You know what? You give me more of that, I'm very happy to pay you for what you do. But if you're not giving me more of that, you're not producing what is expected of you, you're simply doing a lot of things. Yes, you may be working hard, but you're not productive. So you need to understand what every single staff member produces in the office. Let me give you another example, because this is one of my favorite questions to ask doctors. What is the product, the final product of a pretester? And most doctors will tell me, and most practice owners will tell me the same thing. The end product of the pretester is accurate testing recorded properly. And I will tell you, no, that's what they do. That's not what they produce. I expect that pretester to be asking the patient questions that will help preset that patient. So by the time they get to the exam room, they're asking me for things rather than me having to convince them they need things. Let me give you an example. It's the perfect place for the pretester to say to the patient when they're neutralizing the patient's old glasses, hey, do you have prescription sunglasses that you wear when you're driving? And if the patient says no, it's the perfect time for the pretester to say to the patient, you know what? I'm going to make a note here for the doctor to talk to you about that when you get in the exam room. I want you to know that in the exam room, it's so much easier to help a patient to buy than it is to try to convince a patient they should buy. And so if I can use the pretester to preset that patient, so when they get in the exam room, they know the doctor's going to ask about prescription polarized sunwear, that's going to make my job in the exam room so much easier. Or the patient is wearing glasses, for the pretester to say, have you ever thought about going sometimes during your day, doesn't have to be the full day, can just be sometimes during your day, without wearing your glasses, that you could see just as clearly as if you had your glasses on, but you don't have glasses on. And most patients are going to say, yes, I would love that. Great. Let me make a note for the doctor to talk to you about what some of the options are to go without your glasses. And that could be everything from corneal refractive therapy to refractive surgery. It could be lots of ways to contact lenses, lots of ways to open that discussion for that patient. And the job of the pretester is to set that patient up so in the exam room we can take them through to the next step. Proficiency testing. Just because you've trained somebody doesn't mean they actually know how to do it, know how to do the job. So proficiency testing to me is important. And not just at training, but you should randomly proficiency test staff throughout the year. So for example, you can walk into the opticians and say to an optician who's not with the patient, pull a pair of glasses off the frame board, sell me this pair of glasses. Show me why I need this pair of glasses versus anything else you have on the frame board. And the optician should be just ready, able, and willing to just jump right into that discussion and have it. If your opticians are reluctant to do that, that means their training is not at the level it needs to be. We need to absolutely get them to a higher level. And the same thing's true for any stage within in the practice. Show me how to do this pre-testing test. Do this pre-testing test on me. Set me up for the doctor in the exam room. Preset me for them. And to do this, you don't have to do all this yourself. There are lots of industry training programs out there, so utilize those training programs. And just about every vendor and every alliance and every buying group has access to these training programs for your staff in your practice. This is the time to implement in your practice a business dashboard. You need to go beyond just the P&L statement given to you by your QuickBooks or by your accountant. You need to be thinking about a business dashboard that allows you to drill down deeper into your practice software numbers. Are all of your opticians equally proficient, or do you have some of them that are better and have a higher per patient rate than others? If so, wouldn't it be awesome for your better opticians who are more effective at having a dollar sale with your patients, train your less proficient staff so that they use the same words? And an easy way to do this is for the next 3 months, here's what we want to do. We want to do the same words, the same presentation order. We want to do the same things exactly as our high-performing opticians do. And why 3 months? Because it takes about that long to develop a habit. And if we can get our less performing opticians to be performing as well as our higher performing opticians, it raises the skill level of the practice and the ability to provide care for patients. You're not going to know that unless you have a business dashboard that drills down into your numbers and can show you that. In fact, one of the things you're going to find very quickly when you start looking at this is some doctor-optician combinations are better than other doctor-optician combinations within your practice. And understanding what those are and then drilling down to find out why those are parts of your practice management organization that you should know. And here we are in the middle of this pandemic. We, I think, are very close to the top, getting ready to come down the other side of the curve and head towards our opening. So I want you to think about your opening as a grand reopening for your practice. I want you to market this to your patients starting about a month before you reopen, to think about how am I going to do a grand reopening for my practice? What's that going to look like? You want to create lots of buzz, lots of good feelings. And you also want to make sure that you're communicating this to your patients in the context of the message, just like we saw in that contact lens letter sent to the patient earlier in this presentation. We care for you. We want to maintain your health and safety, but we're excited about our grand reopening. And then you move on to discuss that. So as we think about these actions we've talked about, there's lots to do as we move through this pandemic and the downtime that we have during this pandemic. And I'm going to tell you, even after the pandemic, there are still going to be times that come up as we move through the years that come that we're going to have downtime. And during the downtime, you should come back and listen to this webinar again and capture new insights into the things we've talked about and figure out new ways to improve your practice. Now, one of the things I always like to do when I have a lecture or when I have a webinar is to make sure that you really have something that you're taking out of this webinar back and going to make a change in your practice. We've talked about lots of things here. So for the next 15 seconds, I want you to write down the 3 most important changes that you can make to your practice. Whatever those are, write those down now. Type those into your smartphone's text system. Come up with what those 3 things are. And once you've identified what the 3 most important changes are, I want you to identify the single most important change. And I want you to work on that one until it's done. When you have that one done, come back and relook at your list and take the next most important thing and work on that till it's done. I want you to always use your time in the most important things that you can do for your practice. It's way too easy to make a list of 10 things and think, you know what, I can check off numbers 7, 8, and 9 real quick. I'm just going to do those. Well, my hardest decisions in life are not what's between what's good and evil, what's good and bad. My hardest decisions in life are between what's good and what's best. So I want you to use your time in the best use of your time. So what are our key takeaways? Well, number 1, we have to carefully watch our expenditures to make sure we're not moving into negative cash flow as we're moving through the pandemic and out. And we want to make sure that we're using our time during this pandemic, during our downtime, to productively make our practice better, creating that dream practice, providing higher quality care by improving our systems or creating systems that we don't have, and making sure that we're always looking at our numbers to make sure that the practice is fiscally healthy, that it's profitable, because a practice that's profitable is a practice that's able to provide higher quality care to more people, more time. You can purchase better equipment. You can purchase more staff time to work with patients. So profit is not a bad thing. It's a very good thing. And that takes us to the Q&A portion here. If we have any questions that people have sent in while we've had our seminar, I'm happy to answer them.
Thank you, Dr. Wright. Yes, we do have questions, and this is just a reminder, if you haven't entered in your question, please go ahead and chat that in. Our first question is, do you have any suggestions on available training for opticians and optometric techs that might be easy for us to access?
Absolutely. Most of the optical vendors in our profession have programs that you can access for opticians, and even all the way up through to and including optical managers and office managers. So those programs will teach you many different things. It depends on what you're really looking for, but if you would contact your spectacle vendor and talk to them about the programs they offer, you'll find out very quickly they have great materials for you. And don't forget your contact lens vendors as well, because the contact lens vendors have programs as well that you can access and utilize to improve your education.
Thank you. Next question, Dr. Wright, would you think that a practice makes limited changes during this time and plans to run as it had pre-COVID is making a wise move?
Read that one more time for me.
It says, would you think that a practice that makes limited changes during this time and plans to run as it had pre-COVID is making a wise move?
That's what I thought it said. All right. Now, let me answer that very straightforwardly. The new normal will not be like the old normal. You're not going to open your practice and be running your practice the same way you did post-pandemic as you did pre-pandemic. Let me give you a very simple and easy way to think this through. If we do not have a 5-minute test to identify who is infected with COVID-19 and who is not, then we're going to have to maintain social distancing as patients move through the practice. So thinking through how that would look, that means that we need to space patients out as they move through the practice. We need to think about how we're going to seat them in our opticals, how we're going to seat them as they move through pre-test. And then as each patient moves through, we have to disinfect to a higher level than what we did pre-pandemic to make sure that we've killed off any potential virus that could remain on any surface. This is a highly contagious virus, and we do not want patients, staff, or doctors catching this in our practice. Now, if we get a 5-minute test that's relatively inexpensive and we could test every staff member at the beginning of the day and every patient before they move through the practice, then that's going to be a different game. That's a game changer. And that would be available, if that's available, for just all practices, medical practices, dental practices, optometry practices, then that would be an awesome thing. We're not there yet. We have some very interesting equipment that looks like it could move there, but we are not anywhere close to releasing that. So a month from now, we may have a whole different picture to look at. But as we stand this day today, we're going to have to think about having patients stay in the parking lot and not waiting in the practice for us to call them. So we have them pull up in their car, call in, let us know they're there. We will then call them back when it's time for them to enter the practice, checking them for a temperature before they enter the practice with an infrared thermometer to make sure that everyone coming into the practice is not showing us any sort of signs or symptoms of COVID-19. And then as they move through the practice, it's a whole different game. So you have to think this through, because the game after pandemic is a different world than before. And how long do I think that's going to last? That's going to last at least a year to a year and a half, because we're a year to a year and a half out from a vaccine. Once we have a vaccine and people can be vaccinated against COVID-19, then that's another game changer. That would then shift the way we're handling patients moving through the practice. So if you talk to me a year and a half from now and we have a vaccine, we'll be talking about a different patient flow through the practice. But right now, for the next year to year and a half, we have to rethink how we move patients through the practice. And that is a must. That is essential. That's not optional.
Thank you, Dr. Wright. And next question, how can we plan a grand reopening when we just don't know when it'll be? I'd love to give a month's early email blast, but that puts me way out into May. What are your recommendations?
So one of the things we can do is we can look at some of the graphs being used by the doctors who are Dr. Fauci and Dr. Birx. They're, especially the hospital bed graphs, to me are very helpful to look at. And they tend to zero out somewhere around June 1st. And when that zeroes out, what that tells us is the infection rate is pretty much over at that point. And that allows us then to move back into a new normal situation. If we look at the graphs they're using for deaths, always remember that deaths are going to lag, so that even after the hospital beds, and we're not admitting any more people to the hospital, there's still going to be a period of time where people still die. And unfortunately, that's true for the COVID-19 virus. From catching the virus until death is somewhere between 20 and 25 days. So if somebody caught the virus on the last day, let's say June 1st of the graphs that they're predicting how this is going to last, that means that there's another 20, 25 days before they would actually pass in the hospital. But that's in the hospital. That is not going to be in our practices. So I think we have a good window somewhere between June 1st and June 15th that's pretty much where we're going to see practices reopening. Also put into play here that some parts of the country are 2 weeks ahead and some parts of the country are 2 weeks behind. And all of that information is readily available, so you can figure out where you are in that graph. I'm in Ohio, and Ohio is pretty much tracking New York City. So we're pretty much online with what's happening over there. So watching that gives us good insight into what's going to happen here. And watching our local state numbers as well as our local city numbers, we can kind of see where we are in the graph. A lot of this is like watching the stock market. You can never tell when the top of the stock market is going to hit, and you can never tell when the bottom of the stock market is going to hit. And all of your stock market investing literature will tell you that. But you certainly can tell when you're going up the hill and down the hill. And that's the same thing is true for the COVID-19. we're getting close to the top. The numbers are flattening, and in some places, the numbers are actually starting to decrease, and that tells us we're coming down the hill. And down the hill takes us to the point where we'll be reopening our practices. So planning that grand reopening, yes, you can plan that, and the date may shift a day or two or a week or two. But boy, the plan better be in place now, and you better be starting to think about what's going to happen, because that's a time-bound issue.
Thank you. What is your recommendation on how we can clean glasses that have been tried on?
So we know alcohol is an effective disinfectant for COVID-19, but you have to be careful that you're not damaging frames. We know that UVC in particular will kill COVID-19, but again, you have to be careful to make sure that that doesn't damage the frame. So one of the things that we're going to find over the next month is we're going to find our frame companies helping us with that information. They're going to release ways to do this, and they're thinking about that already in terms of what systems can they help us put in our practices to make that system easy. One of the things I first thought of was, do you remember the Transitions Barbie tanning bed? The only problem with that is it's the wrong wavelength of UV light to kill COVID-19. But an adaptation of that, or a version of that where the frames could be put into a Barbie-type tanning bed that would kill COVID-19 in front of the patient. That, to me, would be ideal if we could come out with something like that. And I think we've got enough time between now and the time we open that someone's going to be creative and come up with a great answer for what we need.
And this is looks like a follow-up question. What about reopening our optical?
Yeah, reopening the optical, I think, is going to be in the same box as reopening the practice. It's just going to require that we have social distancing, which means that people have to sit a certain distance apart, and we can argue whether that's 6 feet or 10 feet. But at the end of the day, that needs to be observed in the practice and set out so that it's clear. Marking the floor in terms of where people need to be with respect to other people, that's going to be helpful. There's going to be lots of ways that we do this, but it's going to be for the entire practice. So all of these pieces, I think, are going to flow together. The key message that we have to send out to patients is that we've created an environment that's safe and healthy. And that's true for both patients, doctors, and staff. That's true for all of us. We all want to be safe and healthy. So that's your primary message.
Thank you. And this concludes our time for questions. Recordings and handouts can be found at learnacademy360.com. Be sure to check out learnacademy360.com and register for upcoming webinars. And Dr. Wright, thank you so very much for your time today. It's been wonderful.
Oh, you're very welcome. Thank you.